Vitamin D, the hormone-like vitamin. Vitamin D is not just a sunshine vitamin. Your body uses it more like a hormone to regulate bones, muscles, immune function, inflammation, and parts of the brain involved in mood. When vitamin D runs low, the symptoms can be vague: fatigue, muscle pain, low mood, weaker immunity, and bones slowly losing strength. That is why low vitamin D can be mistaken for stress, burnout, depression, or just getting older. Blood levels are usually measured as 25-hydroxyvitamin D. Many clinicians start paying attention below 50 nanomoles per liter. Below 30 nanomoles per liter is often considered deficient. Modern life makes low vitamin D easy. Glass blocks UVB. Sunscreen can reduce production dramatically. Northern winters weaken UVB for months, and darker skin needs more sun exposure to make the same amount. Iron, the oxygen mineral. Iron deficiency is one of the most common nutrient deficiencies in the world. Globally, anemia affects about 1.6 billion people, and iron deficiency is one of its leading nutritional causes. Iron sits inside hemoglobin, the protein in red blood cells that carries oxygen from your lungs to the rest of your body. When iron drops, oxygen delivery drops with it. Symptoms can include fatigue, weakness, shortness of breath, pale skin, cold hands and feet, headaches, dizziness, poor concentration, restless legs, and sometimes pica, cravings for non-food substances like ice, dirt, or clay. Early iron deficiency can also look like stress or depression, with low mood, low energy, poor sleep, brain fog, and reduced motivation. Higher risk groups include women with heavy periods, pregnant women, children, vegetarians, vegans, endurance athletes, and people with gut disorders. The useful blood marker is not only hemoglobin. Ferritin shows stored iron, and it can be low before full anemia appears. Magnesium, the nerve and muscle mineral. Magnesium is involved in more than 300 enzyme reactions in the body, including reactions that help cells use ATP, the body's basic energy currency. It also helps muscles relax, nerves fire properly, blood pressure stay regulated, and the heart maintain a steady rhythm. When magnesium runs low, symptoms often show up where nerves and muscles are most active: muscle cramps, tremors, eye twitches, headaches, poor sleep, anxiety-like tension, and heart palpitations. In severe cases, low magnesium can contribute to abnormal heart rhythms, including atrial fibrillation. The confusing part is that many symptoms overlap with stress, anxiety, insomnia, tension, headaches, and a racing heart. Risk can rise with high stress, poor sleep, heavy alcohol use, some medications, and diets built around processed food. In Western countries, studies suggest that up to about 50% of adults may not get enough magnesium from food. Good sources include leafy greens, nuts, seeds, beans, lentils, and whole grains. Processed food usually contains very little. Vitamin B12, the nerve protection vitamin. Vitamin B12 is essential for nerves, blood cells, and brain function. The body uses it to make red blood cells and maintain myelin, the protective coating around nerve fibers. When B12 runs low, nerves can start sending signals poorly or incorrectly, causing fatigue, weakness, numbness, or tingling in the hands and feet, balance problems, memory issues, low mood, brain fog, and sometimes confusion. The tricky part is that the body can store B12 for several years, so deficiency may build slowly before symptoms become obvious. B12 is found mainly in animal foods such as meat, fish, eggs, and dairy, which makes vegans and some vegetarians higher risk unless they supplement or eat fortified foods. Risk also rises after about 50, when many people produce less stomach acid, which helps release B12 from food. Metformin for diabetes and proton pump inhibitors for acid reflux can also reduce B12 absorption over time. The key issue is absorption, not just intake. A person can eat B12 and still fail to absorb enough. Zinc, the immunity and taste mineral. Zinc is involved in more than 300 enzyme reactions. It supports immune defense, wound healing, DNA repair, growth, taste, smell, and normal testosterone production in men. When zinc runs low, food may taste weaker, smell can fade, wounds may heal more slowly, infections may become more frequent, hair can thin, and skin problems can appear. In children, zinc deficiency can affect growth, which is why severe deficiency is linked to stunting in vulnerable populations. Absorption matters. Zinc from animal foods is usually easier to absorb, while zinc from many plant foods can be harder to absorb because phytates bind minerals in the gut. Phytates are found in whole grains, lentils, beans, and chickpeas. These foods are not unhealthy, but preparation matters. Soaking, sprouting, fermenting, or sourdough methods can reduce phytates and improve mineral absorption. Higher risk groups include vegetarians, vegans, people with digestive disorders, pregnant women, people with high alcohol intake, and children in regions with limited dietary variety. Globally, roughly 1 in 6 people may have inadequate zinc intake. Iodine, the thyroid mineral. Iodine is the mineral your thyroid needs to make thyroid hormones which help regulate metabolism, body temperature, heart rate, digestion, energy use, and brain development during pregnancy. When iodine runs low, thyroid hormone production can drop, causing cold sensitivity, tiredness, mental slowness, constipation, easier weight gain, dry skin, hair thinning, and a swollen thyroid gland called a goiter. Iodine deficiency used to be common in inland regions where seafood was rare and soils contained little iodine. That is why iodized salt was introduced in the early 20th century. In the United States, it became available in 1924, and goiter rates fell sharply afterward. The modern issue is that many people now use sea salt, Himalayan salt, kosher salt, or specialty salts instead of iodized table salt, and processed foods often use non-iodized salt. Plant-based diets can also be low in iodine unless they include reliable sources like iodized salt, seaweed in controlled amounts, fortified foods, or supplements. The highest risk group is pregnant women because iodine needs increase and the developing brain depends on thyroid hormone. Adults generally need about 150 micrograms of iodine per day. During pregnancy, the need rises to about 220 micrograms per day. Omega-3, the brain fat. Omega-3 fats are important building blocks for the brain, eyes, heart, and cell membranes. The key long-chain forms are EPA and DHA, and DHA is especially concentrated in the brain and retina. This matters because about 60% of the brain's dry weight is fat, and DHA helps maintain the structure and fluidity of nerve cell membranes. Low omega-3 intake does not create one clear symptom, the way some deficiencies do. The concern is more gradual: poorer inflammatory balance, cardiovascular risk, and possibly weaker support for mood and cognitive function. The common confusion is plant omega-3 versus marine omega-3. Flaxseed, chia seeds, and walnuts contain ALA, while fish and algae contain EPA and DHA. Your body can convert ALA into EPA and DHA, but the conversion is usually low, so a spoonful of flaxseed does not reliably replace fatty fish or algae-based DHA. Good sources of EPA and DHA include salmon, sardines, mackerel, anchovies, trout, and algae oil. A practical target is about 2 servings of fatty fish per week, or an algae-based EPA-DHA supplement for people who do not eat fish. Calcium, the bone and signal mineral. Calcium is best known for bones, but it also helps control muscle contraction, nerve signaling, blood clotting, and every heartbeat. About 99% of the body's calcium is stored in bones and teeth. The remaining small amount circulates in blood and tissues for vital functions. When calcium intake stays too low, the body can pull calcium from the skeleton to keep blood levels stable, so the problem may not show up immediately in a basic blood test while bones weaken slowly. Low calcium status can contribute to muscle cramps, numbness or tingling, weakness, fragile bones, and increased fracture risk over time. Risk is higher in older adults, postmenopausal women, people with low vitamin D, people who avoid dairy without replacing calcium sources, and people with digestive disorders. Adults generally need about 1,000 milligrams of calcium per day. Women over 50 and adults over 70 often need about 1,200 milligrams per day. Vitamin D matters because the body needs it to absorb a calcium properly. Folate, the DNA building vitamin. Folate is a B vitamin your body uses to copy DNA, make red blood cells, and build new tissue, which makes it especially important during pregnancy and rapid fetal growth. The timing is critical. The neural tube, which becomes the brain and spinal cord, forms very early in pregnancy, often before a person knows they are pregnant. Low folate during this window increases the risk of neural tube defects such as spina bifida, which is why many guidelines recommend folic acid before pregnancy and during early pregnancy. Folate deficiency can also cause fatigue, weakness, mouth sores, poor concentration, and megaloblastic anemia. Adults generally need about 400 micrograms of dietary folate equivalents per day. During pregnancy, the target rises to about 600 micrograms per day. Higher risk groups include pregnant women, people with alcohol overuse, digestive disorders, restrictive diets, and people taking certain medications that interfere with folate metabolism. Vitamin A, the vision and barrier vitamin. Vitamin A supports vision, immune defense, skin, and the protective surfaces lining the eyes, lungs, gut, and urinary tract. It is especially important for night vision because the retina needs vitamin A to detect light in low light conditions. When vitamin A runs low, one of the earliest signs can be poor vision in darkness. As deficiency worsens, the eyes can become dry and damaged. Infections can become more frequent, and immune defense can weaken. Severe vitamin A deficiency is one of the leading preventable causes of childhood blindness worldwide. The highest risk groups are young children, pregnant women, people with fat absorption disorders, and populations with chronic malnutrition. Vitamin A comes in two main forms: preformed vitamin A from animal foods such as liver, eggs, dairy, and fish, and carotenoids from plants such as carrots, sweet potatoes, spinach, and kale. Because vitamin A is fat-soluble, absorption works best when it is eaten with dietary fat. Selenium, the thyroid protection mineral. Selenium is a trace mineral the body needs in very small amounts to activate thyroid hormones and support antioxidant enzymes that protect cells from oxidative damage. The thyroid is one of the most selenium-rich organs in the body because thyroid hormone production creates oxidative stress, and selenium-dependent enzymes help control that damage. Low selenium status can affect thyroid function, immune response, fertility, and cellular protection. Severe deficiency has been linked to rare diseases such as Caisson disease, a heart condition first identified in selenium-poor regions. Risk is higher in people living in low selenium soil regions, people with digestive disorders, dialysis patients, and people with very limited dietary variety. Adults generally need about 55 micrograms of selenium per day. Good sources include Brazil nuts, seafood, meat, eggs, and whole grains, depending on soil selenium levels. Vitamin C, the collagen vitamin. Vitamin C is required to make collagen, the structural protein that helps hold together skin, blood vessels, gums, joints, bones, and connective tissue. It also supports wound healing, immune function, and iron absorption from plant foods. When vitamin C becomes severely low, the body cannot maintain collagen properly, leading to scurvy, bleeding gums, easy bruising, poor wound healing, loose teeth, joint pain, and extreme fatigue. Severe scurvy is uncommon today, but low vitamin C intake can still occur in people eating very little fresh fruit and vegetables. Risk is higher with heavy smoking, alcohol overuse, restrictive diets, eating disorders, food insecurity, and diets dominated by ultra-processed foods. Adults generally need about 75 to 90 milligrams of vitamin C per day, and smokers need more. Good sources include citrus fruit, kiwi, strawberries, peppers, broccoli, potatoes, and leafy greens. Potassium, the electrical mineral. Potassium helps control the electrical signals that allow nerves, muscles, and the heart to work properly. Most potassium is stored inside cells, where it helps maintain the gradients that make nerve firing and muscle contraction possible. When potassium drops too low, muscles in the heart are often affected first, causing weakness, cramps, fatigue, constipation, tingling, and abnormal heart rhythms. Severe low potassium can become medically dangerous because the heart depends on stable electrical signaling. Risk can rise with vomiting, diarrhea, heavy sweating, eating disorders, restrictive diets, diuretic medications, and some kidney or hormonal disorders. Most adults are advised to get several thousand milligrams of potassium per day from food. Good sources include potatoes, beans, lentils, bananas, yogurt, leafy greens, tomatoes, avocados, and fruit. Protein, the bodybuilding nutrient. Protein supplies amino acids, the building blocks used to make muscle, enzymes, hormones, immune cells, skin, hair, connective tissue, and neurotransmitters. It is not just a gym nutrient. It is maintenance material for the entire body. When protein intake is too low, the body has to ration repair. Wound healing can slow, muscle mass can decline, strength can fade, immunity can weaken, hair and skin can change, and recovery from illness or surgery can become harder. The basic adult requirement is about 0.8 grams of protein per kilogram of body weight per day, but many older adults, athletes, and people recovering from illness may need more. Risk is higher in older adults, people with low appetite, restrictive diets, illness, recovery from surgery, and diets that provide enough calories but poor nutrient quality. Good sources include fish, meat, eggs, dairy, soy foods, beans, lentils, peas, nuts, seeds, and protein-rich whole foods. Vitamin K, the clotting and calcium-directing vitamin. Vitamin K activates proteins involved in blood clotting and bone mineralization, helping the body use calcium in the right places, especially in bones and teeth. When vitamin K is too low, blood clotting can become less efficient, causing easy bruising, longer bleeding, nosebleeds, or heavy menstrual bleeding. Vitamin K also activates proteins involved in bone health, which is why long-term low intake may matter for bone strength. There are two main forms, vitamin K1 from leafy greens, and vitamin K2 from some fermented foods and animal foods. Risk is higher in newborns, people with fat absorption disorders, people with severe liver disease, and people taking certain medications. People using blood thinners such as warfarin should not change vitamin K intake suddenly without medical guidance. Good sources include kale, spinach, collards, broccoli, Brussels sprouts, fermented foods, and some animal foods such as egg yolks, liver, and aged cheese. Choline, the brain and liver nutrient. Choline helps build cell membranes, supports liver fat metabolism, and is used to make acetylcholine, a neurotransmitter involved in memory, attention, and muscle control. It is especially important during pregnancy because the developing brain uses choline during rapid growth. Low choline intake can affect liver function, brain development, and cell membrane maintenance. The issue is that many people have heard of folate in pregnancy, but far fewer have heard of choline. Adult women are advised to get about 425 milligrams per day, adult men about 550 milligrams per day, and pregnancy increases the need. Higher risk groups include pregnant women, people who avoid eggs and animal foods, people with low dietary variety, and some individuals with genetic variants that increase choline needs. Good sources include eggs, beef, chicken, fish, dairy, soybeans, and some legumes. Egg yolks are one of the densest common food sources. Copper, the iron-handling mineral. Copper helps the body use iron properly and supports red blood cell formation, connective tissue, immune function, energy production, and the nervous system. When copper is too low, iron can become harder to mobilize and use, even if iron intake looks adequate. That can contribute to anemia, fatigue, weakness, low white blood cells, numbness, tingling, balance problems, and neurological symptoms. One important cause is long-term high-dose zinc intake, because too much zinc can interfere with copper absorption. Risk is also higher in people with malabsorption, bariatric surgery, digestive disorders, and very restrictive diets. Adults generally need about 900 micrograms of copper per day. Good sources include shellfish, organ meats, nuts, seeds, legumes, dark chocolate, and whole grains. Vitamin B1, the energy vitamin. Vitamin B1, also called thiamine, helps convert carbohydrates into usable cellular energy, which makes the brain and nervous system especially sensitive to low intake. When thiamine runs low, early symptoms can include fatigue, irritability, poor appetite, nerve pain, weakness, and brain fog. Severe deficiency can lead to Beriberi or Wernicke-Korsakoff syndrome, a serious neurological condition involving confusion, abnormal eye movements, poor coordination, and memory problems. Alcohol dependence is one of the biggest risk factors because alcohol reduces absorption, impairs storage, and increases loss of thiamine. Risk is also higher with severe vomiting, malnutrition, bariatric surgery, and some chronic illnesses. Adults generally need about 1.1 to 1.2 milligrams of thiamine per day. Good sources include pork, whole grains, legumes, nuts, seeds, and fortified foods. Vitamin B6, the neurotransmitter vitamin. Vitamin B6 helps the body make neurotransmitters such as serotonin, dopamine, GABA, and norepinephrine. It also supports immune function, red blood cell production, and amino acid metabolism. When B6 is too low, symptoms often involve the nervous system and skin, irritability, low mood, confusion, nerve pain, numbness or tingling, mouth cracks, dermatitis, and anemia. Risk is higher in people with kidney disease, autoimmune disorders, alcohol overuse, malabsorption, and people taking certain medications. Adults generally need about 1.3 milligrams per day, with higher needs in older adults and during pregnancy. Good sources include poultry, fish, potatoes, chickpeas, bananas, fortified cereals, and organ meats. High-dose B6 supplements can also cause nerve damage if taken excessively over time, so more is not automatically better. Vitamin E, the cell membrane antioxidant. Vitamin E is a fat-soluble antioxidant that helps protect cell membranes from oxidative damage, especially in nerves, muscles, immune cells, and red blood cells. True vitamin E deficiency is uncommon in healthy adults, but it can occur when the body cannot absorb fat properly. Symptoms can include nerve damage, muscle weakness, poor coordination, reduced reflexes, numbness or tingling, and vision problems. Risk is higher in people with fat malabsorption disorders such as cystic fibrosis, Crohn's disease, certain liver or bile disorders, and rare genetic conditions. Adults generally need about 15 milligrams of alpha-tocopherol per day. Good sources include sunflower seeds, almonds, hazelnuts, wheat germ oil, sunflower oil, spinach, and avocado. Because vitamin E is fat-soluble, it is absorbed best with meals that contain fat. Fiber, the missing food structure. Fiber is the part of plant food the body does not digest like ordinary calories. Instead, it helps feed gut bacteria, slow glucose absorption, support fullness, improve bowel function, and regulate cholesterol. Modern diets often remove fiber by turning whole grains, beans, fruit, vegetables, nuts, and seeds into refined, softer, lower fiber foods. The calories remain, but much of the structure that slows digestion is gone. Low fiber intake can contribute to constipation, poor satiety, blood sugar swings, higher LDL cholesterol, and poorer gut microbiome diversity. A practical adult target is about 25 grams per day for women and 38 grams per day for men, or roughly 14 grams per 1,000 calories. Most people in many Western countries fall short of that. Good sources include beans, lentils, oats, barley, vegetables, fruit, berries, nuts, seeds, and whole grains. Increasing fiber works best gradually with enough water,